a little bit of space in the low back. And one of the things that people don't really think about is how interconnected our legs are to the glutes, and how oftentimes tension in the legs and the glutes can be a primary cause of low back pain. So I was curious, for those of you that are massage recipients, if you like to have your glutes massaged, or if maybe that's a little bit uncomfortable for you, leave us a comment and let us know, because I think it's one of the largest muscle groups in the body, and it feels incredibly fantastic to have it worked on. So hopefully you'll take the plunge next time and let your therapist work in that area if they haven't already. So we're moving into our second technique, which is just doing some nice compression into the glutes and into the hamstrings. So you can see that I'm just kind of placing my fists with the knuckles and backs of the fingers down. I'm just giving it a nice little rock. I'm just trying to work thoroughly down the back of the hamstrings, and also completely into the glutes as well. So beyond just the glute muscles themselves, so you have glute medius, glute minimus, and glute maximus. You also have some really small muscles that lay deep underneath the glutes, especially the piriformis. And that muscle in particular can be really involved in sciatic pain, which is sort of that pain that you feel kind of radiating down the back of the leg. Sometimes it can manifest as numbness or tingling as well. So getting that muscle really addressed and worked on can be a huge help and source of relief for people that have that type of pain. How's the pressure feeling so far? So just checking in with your partner to make sure that the pressure feels good. And really you can do this compression just a number of times. Each time that you do it, you're kind of working a little bit deeper. And you can make the move more dynamic by doing a little bit of twist or a little bit of rocking. So even though this may feel simple to you as the giver, you can really get a lot of work done and make it feel a little bit more dynamic. Not so boring, although I don't know how massage could ever be considered boring. So I'm noticing that Joy has some tension kind of right here in the middle of her hamstrings. It's a little bit tight in there. And you can see when I'm working in the glutes, I'm kind of just making a nice pass into the meatiest or thickest part of the glutes. So she has her sacrum bone here and the crest of her hip here. And she also has the greater trochanter of the hip here. So just trying to stay within those boundaries so you're not pressing super hard onto any bony prominence. Really targeting into the deep glute muscles here, and then starting to work our way towards piriformis. It's just a little small muscle that runs from your sacrum down into the sits bone. So once we've kind of worked thoroughly doing the compression using our fists, so the glutes and the hamstrings, I'm going to do some active movement with compression. So I'm going to bend the leg using my lower hand to clasp around the ankle. And then I'm going to use my upper hand just to make a static compression. So the movement for this really comes from this nice rocking, or you can even make some circles with the hand that's holding the ankle. And I like to go nice and slow. Just really give the receiver time to feel the work, feel the movement. Your person may be holding a little bit, so just encouraging them to let go of any holding, that they can give you all of the weight and let go of that control. You can even switch directions, making counterclockwise circles now. How's this feeling now, Joy? So just making several passes, kind of working in those glute areas that we already covered with the compression. And just giving yourself the opportunity to feel the muscles moving underneath your hand. So it's just a static pressing and then slow movement, kind of taking the role of that circle as an opportunity to lengthen and move those muscles. And we can continue this sort of active movement down into the leg. So you're welcome to keep with the fists if you want. So you can kind of keep using your fists. Sometimes that can be a bit much for the back of the leg. So sometimes I like to transition into my palms. And similar concept, just kind of applying pressure and then moving the leg. So right now I'm sort of rolling the leg towards the middle, pressing down, and then pulling it towards me. It kind of creates this rubber band effect where you're lengthening the muscles and stretching them against that point of compression. And getting nice into that sits bone area. And then I can kind of change my stance so I'm facing up the table. And we'll do the same thing, so kind of rock towards, place the hand, and then slowly guide the foot away. And working the full length, all the way down into the knee. Do some compression just back and forth. So bending the heel into the glutes, pressing down, and then folding the leg out. And all these different movements just kind of give the massage a little bit more of a dynamic feel. Allows you to work on some deeper muscles that you may not be able to access just through a static massage move. And to help the area relax and release. And making a last pass, just kind of doing a nice back and forth. And we'll go ahead and just gently place the foot down, coming into working on the IT bands. So the IT band is kind of running from the knee to the outside of the hip here. And so I'm just going to take my thumbs, and Joy is a little bit ticklish and also has a little bit of an injury here, so you can see her kind of tense up there. And literally I'm just compressing. And then moving my thumbs upwards. I'm just trying to make little tiny movements along the IT band. And help work out that area, any tension in that area. So working all the way the full length of that IT band. And go ahead and come back down. How you doing? Tender, ticklish? Both? Okay. So I always like to pause if someone starts to have a tense reaction to the work and check in. Maybe there's something going on or they need to communicate something. But try not to just like pull your hands off right away, because maybe it actually does feel good. They just need a minute to relax into it. I'm kind of working down that area. So we're going to move on to the other side. I'm going to show and demonstrate these techniques again. We're also going to share some more information, specifically how each of these muscles can really be involved in that low back pain, or even that glute pain, or sciatic pain. So as I work, I'm actually going to be working across the table just for the demonstration purposes. This is not how I would work in a real life scenario, but it's more so y'all can get some good views of the techniques. So coming back, we're going to be doing a decompression movement. So really trying to just apply pressure downwards towards the leg and getting some movement of the spine so it's decompressing that low back. So just kind of cupping right at the hip and pushing downwards. So coming to decompress the spine, I'm just placing my top hand kind of at the hips and really trying to press downward. So sometimes when you have low back pain or glute pain, it's really just this area right at the crest of the hips and into the sacral iliac joint, so SI joint. And we're just trying to create a little bit more space there. So I'm starting to come into just compressing the glutes and the hamstrings. Maybe give myself a little bit more space here. So right now I'm just using the palms of my hands to do that compression. Doing a nice little rock and roll. You can also use a loose compression of the fist. And then again, just reminding y'all, if I were doing this at home or in the studio, I would be on the same side as the leg, so I'm not working over the table, kind of having this awkward bend. So when your hamstrings become tight, when these muscles become tight, basically you're shifting all the weight sort of downwards. So then naturally what happens is the glutes start to tighten up in response to kind of maintain that postural support. And then what you see is that transferring into the low back, because now as the hips shifted down, the low back's like, well, it's not supposed to be like that. So then the low back gets tight. So you start to have sort of this transference of like, maybe there's one thing going on, maybe it's like your hamstrings are really tight. And that's what kind of sets off this cascade of tension in your body and creates some of these problems with your low back or into the SI joint, or even creating some sciatic-like conditions. So it's always good, even if you feel like, oh, it's just this one area hurting me, to have the surrounding areas worked on, because our body works in a very synchronistic way. very interconnected way. So it's good to explore and see what's going on in every area. Make sure maybe it's not the real reason that you're having this problem or area of tension. So just continuing with that nice compression, sort of doing a little rolling and kneading movement here. That's our second technique. And then we're going to come into doing that active movement. So again, everything's a little reversed for me. You're just using your fist to compress. And then doing some nice rocking with the leg. Gonna go in a full circle. So really here, I'm going to try and bring my hand in between the SI. So the SI joint's up here, but then we have the sacrum. I'm just kind of tracing that with my fingers. And then into the hip and leg. So you have your piriformis kind of runs from here to here. Or from here to here. It might be a little bit lower. It runs a little different. So I'm literally just going to try and compress into that area. And then doing this rocking movement. Seeing if I can guide the weight to target that specific muscle. It's a pretty deep muscle. And see if I can get that area to release. So the couple areas of impingement that are pretty common with sciatic pain are when the nerve passes out through the sacrum down into the leg. It travels by or sometimes through the piriformis muscle. So when that gets tight, it impinges on the nerve and creates that numbness or tingling or pain down the leg. That's one possible location. You can also have it happening higher in the back because the spinal cord ends in the low back. And then all the nerve endings have to kind of curve out, come down, and through the leg. So it could be stuff going on in here, or further into the glutes. But kind of the most frequent one is that piriformis muscle. Continuing with our active movement techniques down into the back of the hamstrings. I'm just doing some nice back and forth rocking. We can also do a roll, compress, and pull away. So rolling towards the side that you're going to be pressing on, making the compression, and then pulling the leg the opposite way. So working on the outer leg and thigh. All the way into the glutes if you want. And then we can do the same thing. So I'd roll towards me, compress on the more medial side, and then push the leg away. And Joyce can feel this, but it's like I start to roll, the muscle starts to roll underneath my hand. Does that feel too much pressure? How's that feeling? Okay. It's going to be a little bit tender or tight on people. And Joy is really good at relaxing her legs, so that's definitely helping. If you feel like you have someone who's kind of fighting you with their legs, it's okay. Our legs are used to being on autopilot, so it's naturally really hard for us to relax that area, especially when it's up in the air moving. So if that's not working for your partner, you can just go back to doing the compressions or see if you can jostle the leg a little bit just to encourage them to relax it a little bit more. And again, just making several passes. Every time you do another pass, you're working deeper. You're getting more muscle fibers involved in the movement. You can make a bigger circle if you want. And just kind of changing it up a little bit. Now we're getting into the IT bands. You can see your fingers are starting to fire a little bit. It's kind of a tender, ticklish area for her. So that was our fourth technique, working on the hamstrings down. And then we're going to do that rolling and compression into the IT band. So again, normally I would be doing this from the other side, using my thumbs to make this movement. But since I'm working across the table, I'm just scooping with my fingers, using the tips of the finger to try and just gather underneath the IT band, pull towards me, and then letting it sort of roll underneath. And you'll notice that all these techniques can be done without oil or lotion. Gives you a little bit more opportunity to grab and work on the fascial layers as well. Working all the way up to that hip bone. So the IT band is a lot of fascia. There's also a little tiny muscle, tensor fascia latae. But a lot of people carry tension in this area, so it's really good to work on it. And also keeping in mind that it can be pretty sensitive. So one of the things that you can do if it's sensitive is just to try and slow down the movement. So I'm trying to not work so fast. And then encouraging the receiver to take some nice deep breaths. And really tune into the work, see if I can let go of any tension in that area. And just applying some gentle pressure, or more firm pressure is their preference. Working all the way up to the hip bone. And then I just like to close with more compressions down the leg. Just kind of covering that same ground that we were working with.